I'm Jordy Cohen. I'm an associate professor of medicine and epidemiology at the University of Pennsylvania, where I practice as a nephrologist, an epidemiologist, and a hypertension specialist.
And I'm Tammy Brady. I'm a pediatric nephrologist, a professor of pediatrics and epidemiology at Johns Hopkins University, where I work in the pediatric hypertension space, and I work to help prevent cardiovascular disease and promote cardiovascular health across the lifespan.
And so we're here today to tell you about the exciting American Heart Association scientific statement on cuffless devices for the measurement of blood pressure. The statement will be describing some very, very important components about these new devices and this technology, including the fact that it's really promising. It's a way to help remove a lot of the barriers to blood pressure measurements and improve accessibility of blood pressure measurements. But there are a lot of concerns before it can be ready for clinical use, particularly for the diagnosis and treatment of hypertension. Most notably, the accuracy issue is really important. These devices still have a lot of issues, particularly in terms of their real-world accuracy and whether or not they can even be used in situations where people are moving, when they're often used, especially in devices like a watch or a ring, where you're going to be moving your arm around all the time, and other potential factors that can really impact their accuracy, like how your blood vessels behave and other components of waveforms and other blood vessel characteristics that might impact the ability of these devices to really be able to extract what a true blood pressure is.
And I think one of the things people don't realize is how important calibration is to the accuracy of these devices. I suspect in the future that there will be devices that are sort of plug and play, ready to go as soon as you just put the device on. But right now, really, if you want a device that's going to give you a number that's supposed to indicate what your actual blood pressure is, you need to calibrate the device. And that means you need to have a cuff device, and you need to know how to measure blood pressure using a regular cuff device. The accuracy of these devices rely really heavily on how well, it's only, as good as the information that you give it, right? So if you don't measure the blood pressure properly with a cuff device and input it into this cuffless device, you may not have accurate measurements. And I think the other thing, this technology really has been advancing very quickly. And so we, in the field of trying to make sure devices are accurate, have been really struggling to keep up. And so there right now are no validation protocols to test whether or not these devices are accurate. Hopefully we'll have them soon, but this is something that we don't currently have. We're able to tell whether or not devices that are used in the operating room that are cuffless, that give you really continuous measurements, we have some protocols for that, but not for the ones that you're meant to wear and use in your everyday life.
Really, really important points. And I think taking it all together, even once we do know that these devices are hopefully accurate, which we're hopeful will be the case in the future, a lot more needs to be done also to think about implementation of these in the real world. For instance, to responsibly use the data, to think about what the data even mean that are being measured in ways that we may not have been measuring blood pressure before, and also to just think about how to integrate them with healthcare systems and to think about how they'll be used in day-to-day care. And so there's a lot more to unpack, and we really hope that based on what you've heard, that you read the statement and learn more.